This session will be on short order sets. We're going back to our patient Foxtrot order. Let's go to order sets. We have two options. Short sets, which will be orders such as alcohol withdrawal, substance abuse withdrawal, which we'll talk about in a little bit. And then there's order sets for insulin and pain, which we need on our patient. So let's start with insulin. Subcutaneous insulin, done. Basically, this order set has a reflex order in this. So if the patient becomes hypoglycemic, it prompts the nurse to initiate the hypoglycemia protocol before calling the resident. So a therapy will be in place while they're trying to contact the provider. And this is automatically checked off in this order set. We have to click type of diabetes. Again, the red pencil prompts. F9, type 2 diabetes. Okay. There's an option to order some labs. We already ordered the diet, so there's no need to do that. We want to order finger sticks. Let's do every 6 hours. Our patient is not eating. There's no need to go into the blue pencil unless you have specific instructions, only the red pencil. We don't need to consult endocrine in this case because it's not a complicated patient. The hypoglycemia protocol, again, automatically checked off. But the red pencil is here, so we have to go through to make sure we agree that this is going to be PRN, hypoglycemia treatment per protocol. Okay. As needed. Okay. Because this is a medication. Let's go down. In our patient, we did order Tresiba, but say we're ordering, we always want a long-acting insulin in all type 1 diabetics, but say we want it in our patient. It notifies us that it's high alert. Let's pick a dose. Let's do 5 units again. Okay. Okay. So now we have our basal ordered. We want a short-acting insulin. This would be insulin with meals, a correctional dose, but we also want the correctional dose. So our patient is not eating. So let's click that. Pick our scale. Low dose. And then let's go down. We're not doing an insulin pump. If we were, there's specific instructions there. These are the instructions for the nurse with the dextrose, which we have to approve. 15 to 30 grams as needed for hypoglycemia. Okay. $25 to $50. Okay. This is the insulin we ordered. It wants us to be aware that we're ordering 2 different insulins, which is appropriate. Override. There's our scale. Okay. Tells us it's high alert. Okay. There's a lot of stops built into the system to make sure to try to avoid errors. Done. All right. Our patient, we also need to do a pain order set. So let's go back to order sets. Pain. We have an opiate naive patient. Let's click that box. Done. Now, as you'll see, Narcan is in all of the opiate order sets, which is why it's essential not to just order opiates on their own. It should be done with the opiate order set because this allows the nurse to use the Narcan to pull the Narcan as a rescue. Because it is a medication, we have to go to the red pencil and confirm that we agree with the directions. Okay. So in this patient, we're going to do pain medications every 6 hours. Click. This is if we want to give the patient some Reglan or Zofran. Okay. So let's click. the medication. Let's choose the medication that we want. Let's see what our options are. F9. In this patient, we could do morphine, oxycodone, Dilaudid. In this patient, he's elderly. Let's choose morphine, 1 milligram. So that'll populate with 1 milligram for a pain scale of 1 to 5, and it automatically pulls in 2 milligrams for a pain scale of 6 to 10. And then if we click here, the breakthrough pain medication will also populate. Let's hit OK. Close. Done. OK. And this again alarms us that multiple doses of morphine are available. We agree. Override. We already know we ordered this. OK. And submit. The next session will be on alcohol and substance abuse.